Under this bill, we know that Washington State is going to lose about between 31 and 51 billion dollars in federal Medicaid spending, or federal Medicaid funding over the next decade. That's about 250,000 people here in our state who will lose their Medicaid funding. We call it Apple Health here in Washington State. They will lose it. A lot of other people will see their costs rise or their ability to access it really get impeded. The other thing that's in the bill is the tax credits for the ACA were not extended. So thousands of people are going to see their health care costs go up, their premiums go up for the ACA coverage, and that means that a lot of people will lose it. They will not be able to afford it. And the impact of all of this is not going to be to people who lose their coverage, but to our providers who are going to have more people walk in the door without any kind of health insurance or health coverage, which means the uncompensated costs are going to go up. That means here, especially in Eastern Washington, Central Washington, a lot of our providers are going to go out of business because they just can't afford to keep their doors open. So we know that hospitals here in our state could lose up to $662 million in Medicaid revenue every year. That's a lot. It's going to have a huge impact. So I'm delighted to be here from some people who understand the impacts of this and are going to help us, help everyone understand it and help me fight back in the other Washington. We've already introduced legislation to repeal these, but it is an uphill battle. We do have a Republican majority. They just passed this into law. Convincing them to undo what they just did is going to be hard, but we hope that with everybody talking about the impacts of this, we can get them to join us. And we also are here to talk about Planned Parenthood, which lost its coverage in that bill, and to hear about the impacts here in Washington State as an additional huge cut to healthcare access for everyone. So with that, I'm delighted to have the experts here today, and I'm going to start with Shane Magguire, CEO of Columbia County Public Hospital District, and talk about it.
Yeah, thank you for having me. The impacts of this bill cannot be sort of understated. Health systems in Washington State are already stressed. Washington has some things that make it unique. For example, I don't know if you guys realize this, but we have the lowest number of hospital beds per capita in the nation. And so there's already a lot of strain to get people moved from rural healthcare systems to large healthcare systems for important things like surgery, cardiac surgery, and those types of things. When you're going to add more stress on an already stressed system, it's going to be really challenging to deal with. 30 out of 39 counties in Washington State are considered rural. So I'm talking about Columbia County, but also representing many of those other counties that are in the same boat. We were one of 24 hospitals that received funding from the Distressed Hospital Grant this year. That is a pretty large increase from the previous years. More rural hospitals are distressed financially. Our days cash on hand has put us in a category of high risk of closure. When we look about how this bill is going to impact, there's been 136 rural hospitals that have closed since 2010. 74% of them have closed in non-expansion states. Sort of that tied directly to Medicaid health and expansion states and the health of rural healthcare. And this bill directly attacks that type of funding. And so we're supremely worried about it. We're worried about the direct funding impacts, but we're more concerned about the disenrolling or unenrolling of Medicaid beneficiaries. A person's health care needs don't go away when they lose coverage. It changes how they seek coverage. They may delay care, they may get sicker, and then they're going to show up at an emergency department in a bad shape and with no coverage, which is going to increase our uncompensated care. When we look at the things that have attributed to those hospitals that have closed nationally, uncompensated care was a big part of the reason why they closed. And so we know that this is going to disenroll folks. I would say that, from our perspective as a rural system, you're not just going to curtail services that Medicaid population uses. We use blended or braided funding to fund our operation. And so with the loss of the Medicaid revenue, it's likely going to impact care for commercial payers and Medicare payers as well. We're not going to be able to sustain certain service lines, and we're going to end up reducing access to care. We're already working on strategies around what that looks like. I'm really hopeful that we can keep the attention up on this because it doesn't come into effect for another couple of years. And I think people are going to forget that this bill today is going to profoundly impact the way they seek and receive care 2 years, 3 years, and 4 years from now. So I thank you for the opportunity to talk to you. I look forward to any questions you may have.
Great. Thank you very much. Christy?
Thank you again, Senator Murray, for inviting all of us to attend this gathering. And I'm honored to speak on behalf of our 2,000 employees and 200,000 patients that we see across Washington and Oregon. We are one of just many community health centers across the nation that serve a vital role in providing primary preventative care. It's also National Health Center Week and celebrating 60 years of the community health center movement. And it has been designed to provide access to affordable quality health care that meets an individual's needs. The health centers have now become a critical part of the healthcare infrastructure. We serve over 10% of the U.S. population, and in some rural communities, health centers are probably the only healthcare provider available. The Congressional Budget Office has found that healthcare provided at health centers really improves the rates of chronic disease control and saves money downstream. For every dollar spent in primary care, we are saving $13 in downstream costs, which is to your point you made out earlier. So how do these Medicaid changes impact us and our patients? I would say two big things for the patients that we see, which are the new 6-month renewal cycle, as well as the 80 hours per month of community engagement requirements. This is going to impact those adults that gained Medicaid coverage through the Affordable Care Act back in 2014. So in Washington State, that represents about 30% of the Medicaid-eligible health population. For us here in Walla Walla, for our patients, it's about 2,000 people, and across our network, it's 45,000. We're going to do everything we can to make sure our patients stay enrolled in their Medicaid coverage, but we do know that some will lose coverage, and the state of Washington, I think, is estimating around 40 to 50% will lose coverage. As health centers, we're going to continue to see our patients regardless of what their coverage is, as we have always done. Health centers receive about 60% of their revenue is from Medicaid. So once that starts eroding away, we're going to have a lot more uncompensated care to deal with. This is going to impact our ability to dip into our sliding fee money that we get from the federal government to help with uncompensated care. We're going to be asked to stretch those dollars even further. It has been publicly said that the health center system is kind of expected to pick up the burden of the uninsured. So, today in the United States, 1 in 3 people have a major chronic disease, and also at the same time, 1 in 3 people lack access to primary care. So that's a bad combination. There have been some recent studies that have shown improved health outcomes for individuals who have gained access to Medicaid through the expansion under the Affordable Care Act. Our own data supports that. We track metrics for both people that have diabetes and high blood pressure. And for our adult Medicaid population, they are improving at a faster rate than our general population. So fully supports that other study that I referenced. And just, I have a patient story about someone who gained access to Medicaid coverage back in 2019. 50-year-old male with a history of uncontrolled hypertension. He got enrolled because of Affordable Care Act. He's been engaged in his education. He did some lifestyle modifications and has been compliant with his medication. Today, he is still in control, and that is all due to his access to affordable care. I'm a little worried about losing progress in these outcomes. A lot has been made over the past decade, and with many people possibly losing their coverage, I'm afraid those advances are going to reverse. I look to Congress to, look at the impact these cuts are going to have, And the health center community needs additional funding if we're going to be expected to take on the additional uninsured. Our community health center funding has been pretty much flat for a very long time, which, you know, was manageable when we had Medicaid coverage for our patients. With that going away, we cannot take on the extra burden of more uninsured without some adjustments. So we are happy to fill the gap, but we need support from our policymakers to do so.
Thank you very much. Will, we'll hear from you.
Good morning. My name is Will Matney. I'm the nursing director at Chaz Health. For those of you who may not know, Chaz Health is a federally qualified health center based out of Spokane, Washington, serving both urban and rural communities. We're the primary healthcare provider for 1 in 5 residents in Spokane County, and we provide comprehensive medical, dental, behavioral health, pharmacy services to all of our patients. Support for community health centers is one issue that everyone, Democrats and Republicans, senators and representatives, can agree on. We meaningfully benefit patients, communities, and our nation's health. Additionally, Chaz Health, we provide care for patients in Assotin and Whitman counties through our standalone clinic locations, including a dental clinic in Clarkston, Washington, and our mobile units that travel to rural communities and provide health care where there isn't healthcare access. Access to primary and preventative care at CHCs reduces utilization of costlier services such as ED utilization and hospital admissions and readmissions that are unnecessary. Many of our patients have incredibly difficult lives as is. As a community health center, we also provide wraparound services that care for the whole patient and meet all of their needs. And we help reduce barriers to care, thereby increasing their health and wellness and ability to access care, which then ripples into the rest of their lives and impacts their day-to-day life with employment, caring for their families, going to school, etc. In 2024, Chaz Health served just under 110,000 patients residing in Washington. 53% of those patients were covered by Medicaid. Those are really big numbers in the scheme of things, but for me, those are individual patients that me, my nurses, and our healthcare team see on a day-to-day basis. People that we get to know personally, who get to know us. People with families, people with jobs, people in school, people who are just trying to survive and don't need any more additional barriers to care. A patient that I think of is somebody who I was seeing for wound care, who was a type 2 diabetic, had a chronic foot ulcer, which is a big wound on your foot, and this person was a full-time security guard. Somebody who's walking around all day with a big, painful limb. And because this person was covered, they were able to access services through us. We were able to see this patient 2 to 3 times a week, providing wound care, the right dressings, offloading pressure, and essentially healing the wound and getting to the point where they weren't walking around in chronic pain all day. They were able to maintain their employment because they're on the brink of losing it because of this wound. And now, this person is a controlled diabetic without any foot wounds and is the healthiest they've been in 20 to 30 years. There are a lot of misconceptions held about people on Medicaid, but I can tell you from personal experience, these are patients that I work with. They're working, they're going to school, they're raising a family, and they're contributing to the betterment of our communities in multiple different ways. And without Medicaid coverage, many will avoid care, as which was mentioned earlier. And from there, it's a backhill slide in their health and wellness. Like was mentioned earlier, they're not going to engage in care because they can't afford it. Their chronic conditions are going to deteriorate, and it can result in hospital admissions, ER visits, and sometimes death because they need this access to prevention. One of the reasons I chose to work at a community health center is our mission to serve all residents of our community. And that means that we serve regardless of whether they have insurance or not. If they come into our doors, we're going to take care of them. We're not reimbursed for that care, but that's our commitment to our community. And as healthcare providers, is that we're going to take care of the patient that's before us. This decrease in payment, along with other significant cuts to funding in the healthcare system at large, directly impacts our ability to provide care to patients and meet the needs of our community. The changes coming to the Medicaid program and the impact it will have on the finances of community health centers and every healthcare provider is truly astronomical because we want to provide the care to these patients, but without the funding, we're not able to. These changes will put our entire healthcare ecosystem into a crisis that will take a long time to recover from and diminish a lot of the work that's been done in the last decade to provide care to patients. Thank you.
Well, thank you so much for having me here today. My name is Carl Eastland, and I'm the CEO of Planned Parenthood of Greater Washington and North Idaho. Thank you so much, Senator Murray, for your decades-long commitment to supporting public health in all of Washington State. Want to make it clear today, across all of Planned Parenthood's 29 clinics across the state, we see over 100,000 patients a year, and this issue is not about abortion. A lot of times when people think Planned Parenthood, they think this is focused on abortion. Currently, no Medicaid funds, no federal funds go for abortion. So this is about all of the other services that Planned Parenthood does for, again, well over 100,000 patients across the state. Well over 90% of what we do is on basic preventive care. We are very proud to be abortion providers, but our patients also rely on us for so much other care as well. So when you think of the work we do on our traditional patient, they're generally someone in their 20s who is trying to do better for their community and do better for their families. They're coming to us for birth control visits, STI screenings, cancer screenings, and a lot of basic preventive care. This is diabetes checks, high blood pressure checks. We really are proud to be vital parts of the public health network, where if someone has bigger issues, we can refer them on to our partners that are also incredibly important in this healthcare system. So I just want everyone to know, this is not about abortion. This is about eliminating access for nearly half of our patients that are coming to us for basic primary care services and birth control visits. When I think of the Foundation for Public Health, or Foundation for Strong Communities, it truly is access to healthcare. So you think if someone has access to healthcare, they can continue their education, they can do great with their job, they can get promotions at their job. If you take away that access to healthcare, we will see it, as other speakers have said, a devastating effect on reducing our ability to have strong, vibrant communities like we have in Washington. If you need any more evidence on how this works, we can look east to the state of Idaho. They have dramatically cut access to care and passed laws that make it harder for doctors to do their important work. We see patients every single day that are driving hundreds of miles from Idaho to our Washington health centers for basic health care because they can't get it in Idaho. Over 35% of the women's health providers in Idaho have actually left the state because it is so difficult to provide care there. Trust me, from a public health perspective, we don't want to be Idaho. We're all really proud to be Washingtonians, and the path that Senator Murray has helped us create here in Washington is something we should be proud of and we should really fight to preserve. So again, going forward, I would just ask you, continue to support Senator Murray. Thank you so much for meeting with our staff and our patients and understanding these issues and highlighting their importance. I also would ask you to help work with Governor Ferguson. He has been great in understanding the issues and pledging to help Planned Parenthood for the next year as we deal with these cuts immediately. And I think thirdly, I think it's incumbent on all of us to ask our representatives why they voted for this. We have two representatives in this area, Representative Baumgardner and Newhouse. And I think we've tried to meet with them. I know they're not meeting with people. I don't know if they're ashamed of how they voted, but I think it's important to call out that they're giving tax breaks for billionaires to make our communities weaker. And I think it's something that we should demand answers from them on why they voted to weaken their communities, to weaken the public health network in their communities, and to overall put Washington behind in the progress that we're making. So again, just can't thank you enough, Senator Murray, for your decades-long commitment and coming today to highlight these issues.
Thank you, Carl, very much. And I'm going to open up for questions, but I want to make just a couple points. You rightly stated that some of these Medicaid cuts and impacts will be 2 years from now. But we are already seeing the impacts of that because the insurers who have to make their decision, that's your employer-based insurance, your private insurer, are already telling us that they are going to raise rates as much as 20% for people who have insurance because they see these cuts coming. They know there will be more uncompensated care, and they have to plan for that. So everyone is going to see their own health insurance go up. The second point I just wanted to emphasize, and Chris, you referred to this a little bit, is the work requirements that are coming for Medicaid patients. I constantly hear from people, waste, fraud, and abuse, and these people should be working. The vast majority of people on Medicaid are working. Christy, I think you can attest to that in your clinics. But the impact of these work requirements and our state having to set up a new system, people having to go in every 6 months to verify that they are working is going to be extremely complex. A few states that have tried this quickly abandoned it because the costs were far more impactful than the work requirements themselves. And I would just add for everybody here, in rural communities like this, it's hard to get a job. And it's hard to get a consistent job. And it's hard to get 80 hours of consistent jobs. So if we tell all of those people, just forget it, they will come to our clinics. Anyway, Christy, thank you for, and everyone for providing care for them. But they still have a cost to them. And all of us are going to bear the burden of that. So now is the time for us to really work hard to try and repeal these requirements. But again, it is an uphill battle, and we need the participation of everybody to fight back. So appreciate everybody coming today, and happy to open it up for a couple questions today. Yeah.
Good afternoon. My name is Sarojit Kaur. I'm the federal policy reporter at the Walla Walla Union Bulletin. Senator Murray, my question is for you. Can you provide an update on your bill to restore federal funding for Planned Parenthood clinics, and how do you hope it will offset the impacts of the Big Beautiful Bill on reproductive care access? And also, are you planning to introduce legislation to restore medical funding for Medicaid funding for other critical services at hospitals and community health centers beyond Planned Parenthood?
Okay, so first, just specifically to Planned Parenthood, we have introduced legislation to repeal those provisions. Again, it is going to be an uphill battle to do that, but we think people, when they truly understand the impacts of these clinics closing across the country, the impacts on other providers, the impacts on patients, the impacts on women, we want to build that support, but it is going to be a challenge. Second answer, yes, we've already introduced legislation to repeal these cuts, but again, the Republican majority just voted to put this in, so convincing them to turn around and vote against it will only happen if they truly understand the impacts and get past the talking point of waste, fraud, and abuse, and people just need to work, because both of those are just not true. No worries.
Come back to me, sorry. Do you want to ask that question? Yeah. So, how do you think the Medicaid funds cuts to them are going to impact rural communities?
It's going to have a huge impact in rural communities, especially because we have the highest population per capita of Medicaid patients in our rural communities here in this congressional district and in the 5th. So that high percentage, and probably you can speak to that, Shane, better than I can, of what percentage that is in the facility where you
The thing that we need to really remember is patients are transient in nature. They seek care of multiple organizations, but we're also interdependent. Even from my perspective, I routinely take patients from the Tri-City region to come and rehabilitate in our swing beds. Those are often Medicaid beneficiaries. And so we try to say, well, it's regionalized and this hospital's got this many Medicaid beneficiaries. It's going to impact all of us. It's going to impact all of us because we're interconnected. There's no system independently that can absorb any kind of loss of resource in the communities. So if a rural hospital closes in Dayton, that means there's less primary care, there's less hospital care, there's less transportation for non-urgent medical, and there's no organization that's going to be able to absorb that. So that's the first thing I'd want to say, is that it's not really just about a specific individual hospital, it's about how we're interconnected when we deliver care. You heard the panelists say a lot of preventative care is being done, and if that preventative care isn't going to be done in an FQHC or Planned Parenthood, we cannot absorb it. We cannot absorb that extra load because we don't have enough providers to do it. And without the coverage, the lack of compensation, we're going to be put in the same financial position that they are in. So, for our community, it's 20% Medicaid beneficiaries for just the people that live in our community. But the Medicaid population that we serve beyond that is much bigger.
One of the things I hear people who voted for this legislation say, make it sound as if a Medicaid beneficiary gets some kind of check. That's not how this works. People show up to a provider to get the care they need. The care provider, the hospital, the clinic, gets reimbursed for that care. If they don't get reimbursed for that care, they have to spread that cost to everybody else. That's why costs go up. Medicaid financial burden. Uh, I don't see it as a financial burden. I actually see it as savings for everyone. When in this country, where everybody gets access to care, you guys don't turn patients away. It spreads the costs so that the costs are lower for everyone. The patients who are on Medicaid still show up if they have cancer, if they have diabetes problems, if they have an accident in a car, if they have a baby, if they need any kind of care that anybody here provides. They still show up for that care, maybe late, and then it's more expensive. Maybe when it's almost too late to even help themselves. So healthcare costs are there no matter how we pay for them in this country. Taking away and cutting Medicaid, the biggest cut in the history of this country, is only going to impact every single person's ability to get health care.
I would augment that by saying that keeping people at work and productive comes at a much lower cost than having them become debilitated and unable to work. And I think the example that you suggested about wound care, the survival rate on a patient after a lower limb amputation with chronic disease is like 50%, 5 to 7 years. And they can go from walking, working, to lower limb amputation, to high cost of care at the tail end of their life. And so really anything that's preventative, anything that's covered for primary care actually probably saves money over time versus where we're headed right now.
So what things could be cut to make Medicare?
Well, let's be clear. The way Medicaid works right now in this country is pretty darn efficient, works really well. What Republicans did in Congress was they passed these cuts to Medicaid in order to what they called savings to be able to lower taxes for really wealthy people. They needed the money to pay for it, and that's how they are doing it. So in my opinion, billionaires didn't need another tax cut, but people who access healthcare every day need that access, and it's going to cost us all.
When Congressman Michael Baumgartner visited Walla Walla last month for a town hall, he defended the bill, claiming that two key reforms will strengthen Medicaid. One is eliminating eligibility for undocumented immigrants, and another requiring able-bodied adults to work at least 20 hours a week, excluding caregivers and those with mental conditions. So what is your response to
Well,
this?
I'd say he just doesn't know how the system works. First of all, undocumented immigrants, as our providers can tell you, still need care. They're in our community. They will show up for that care. Or they will impact a lot of other people if they have a communicable disease and it isn't taken care of. So in Washington State, we have a system that makes sure that everybody gets access to care. So that's not going to save anybody money. And the workforce work requirements, to me, is just like a canard, because the vast majority of people on Medicaid are working. And the fact that the ones who are not, they are seriously ill or taking care of a child, so they can't work. Requiring them to work just merely means they will not get access to covered health care and still show up for care in our communities. But it really is a disservice to people on Medicaid to make it sound like they are just sitting around doing nothing all day, showing up at the healthcare community clinics or somewhere for care. I think everybody here who provides access to Medicaid recipients can tell you they are hardworking people. They're doing the best they can. Maybe they don't have 20 hours or 80 hours a month of work that is consistent. And again, going back to those requirements, our state will have to set up a system for people to sign up and prove that they are working 80 hours a month. Now, some people work in a restaurant and only work 18 hours one week and maybe 22 hours the next, and they're gonna have to keep track of that. For everybody who signs up for insurance once a year and goes, oh my God, this is just a lot of work, think about how you would do that if you have to prove that you worked and do it every 6 months, and how we ever set up that system. I don't even know how we're gonna do it.
Well, and to add to that, it's not just the state that's going to be incurring costs. Health centers help their patients stay enrolled. And so we're going to be doubling our workload for the adults that need to meet these requirements, plus add on the burden of the work requirement documentation. So we're looking at additional staffing costs to help our patients. So that's just an additional cost that's going to be incurred. Yes.
Well, I'm not in the Washington State Legislature, so I can't answer that question. You might know from Planned Parenthood what they're planning to do, but I can tell you just from my own knowledge, Washington State Legislature is struggling with a budget deficit right now. To turn around and ask them to come up with all of the additional dollars to cover this means that we're going to lose out on other things here in Washington State and probably have a really hard chance of getting anything passed. But
Right. And I can just speak to Planned Parenthood. You know, our Medicaid cuts happened immediately, so they took place not after the next midterms, but right after the bill was signed into law. There is an injunction on that. So we think it was illegally done. We don't think it follows the Constitution, and so we are currently still providing services as a normal Medicaid enrollee, and the governor has said we also agree that this was done illegally, and as Washington State, we're going to stand up for our providers and fight as much as we can to see if we can fix this through the legal channels for the next year, while allowing us to continue to see patients, because it would be devastating for us to call patients and go, if you're Medicaid, you can't come anymore. So we've prevented that crisis in the short term, but there's still so much work to do. As we get into the middle of 2026 and beyond, the cuts are really going to start to cascade, and it's going to have a much devastating effect in the communities.
Yes.
Sure.
So what is your message to residents who supported the legislatures behind this Medicaid cut?
I'm here today to sound the alarm because I think a lot of people here in this community just think it's not going to impact them. It is going to impact everybody. We're going to see hospitals closed, providers shut down. We're going to see harder access for everyone. People who do have health insurance through their employer right now are going to see their costs go up, and we're going to see healthcare impacted for everyone in our community. So I'm sounding the alarm, and I'm telling people I'm fighting back. I'm doing everything I can to introduce legislation, and there's litigation going on as well for Planned Parenthood. But everybody needs to stand up and say, wait a minute, we do not want that for our state or our country.
I think there's some focus on the $50 billion that they've set aside for the rural fund, and I got to tell you, it's woefully inadequate. They've cut $150 billion worth of funding, and they're trying to say, well, here's $50 billion to make up for it, which is really only $10 billion a year for 5 years. It's not going to cover the shortfall, and it's not going to patch this legislation. But I see and I hear that as a talking point. Well, we took care of that because of this fund. Is not adequate. It's not going to address the loss.
It's actually a $900 billion cut. They created a $50 billion cut over 5 years, a $50 billion pot of fund over 5 years that states can apply for if they can qualify for it to see if they can get some money. First, Washington State will have to ask for it. Chances are they might not get it, but meanwhile, healthcare facilities are looking at their budgets moving forward. If they're operating under, can't meet their payments right now, they're not going to say, I'm going to sit here for a year and a half and hope to God I get a few $1 million from that fund to help save me. They have to plan on a real basis. That's why we'll see hospitals shut down.
The other thing I'd add to that is the working poor are kind of getting a double hit. They're going to have these additional requirements to stay eligible, and also the tax credits on the exchange are going away. So it's like you're kind of in this no-win situation in facing significant challenges in maintaining health coverage.
Great. Thanks, everyone.
Thank you, everyone, and thank you all of you for helping explain how this is going to work. Really appreciate it.